All right. So acetaminophen inhibits prostaglandin synthesis. What are prostaglandins? Pain producers. So it only is two things. It's an analgesic, which means relieves pain, and it's an antipyretic. Decreases fever. Okay, that's the only thing it does. It's not an NSAID. It's not an anti-inflammatory. You with me?
Yes.
Okay. It is also not antiplatelet.
Okay.
And I wrote it down on your sheet.
It is not.
Okay. All right, so all it does is treat pain and fever. It is safe at normal doses, but people don't take normal doses. They be popping those like candy, right? Okay. This is on your test. Max dose, 4 grams a day for all of you. I don't care who you are. It's always on the test. Okay. And this is very, very, very important because remember, I just said that acetaminophen comes mixed in a bunch of drugs.
Yes.
So you have to go back to your MAR and calculate how much acetaminophen they've had that day before you give another dose.
Okay.
Because you could be following your MAR exactly and giving it as prescribed, and you can still overdose your patient. Okay? Because what I mean by that is usually if a patient is in the hospital, they're in some type of pain.
Yeah.
Let's say they ordered Vicodin. Okay? Vicodin has acetaminophen in it, and it was given twice during the day shift. Okay? So they've already had 2,000 milligrams. Then later on, the patient was not in that much pain, but they were in a little bit of pain, so they just gave them flat out acetaminophen.
Yeah.
That was another 1,000 milligrams. We're at 3,000 right now. Okay.
Yeah.
And then the patient has a fever. So that was given 1,000 milligrams. So we're at 4,000 milligrams. It's only been 16 hours. You're well within the 24, but they're already at 4 grams. They're already at 4 grams. Yeah. So even though you can't just follow the MAR, you have to go back and calculate how much acetaminophen they've had that day because it is very, very, very liver toxic. Do you understand?
Yes, ma'am.
So if you guys go out drinking, the last thing you want to do is pop 2 Tylenol before you go to bed. RIP your liver. You will feel so much worse the next day. Okay? Kill your kidneys instead. Try some ibuprofen. Okay? All right. Side effects. Now, highlight this. Acetaminophen has a cross allergy to aspirin. What? So if you're allergic to acetaminophen, you're also allergic to acetylsalicylic acid, which would kind of make sense. All right. It does not usually cause hypertension unless you're a woman and you're taking it at very high dosages. Of course, right? Rude. Adverse effects. Here's our friend, Stevens-Johnson syndrome.
So
okay.
Hypertension only in women?
Only at high doses in women. Yeah. Okay. So it can also cause, no big deal, just acute generalized exanthemus pustulosis. So what does acute mean? Happening now. Generalized.
Some specific spot?
No, that's everywhere. Generalized. If you say like generally speaking, that means like across the board. So everywhere from head to toe. Exanthemus. What's a exanthem? Exanthem means rash. Exanthem means rash. Pustulosis. Pustules. Giant pustules all over their body from head to toe. Now that sounds like a fun day. Better than Stevens-Johnson syndrome though, I guess, right? And then no big deal, just toxic epidermal necrolysis. Toxic means it could kill you. Okay. Epidermal, skin, necro, dead tissue. Yeah. All your skin can die. So, that's not worth it for 2 Tylenol.
Well, I feel like this all calls out like SJS.
Yeah. Major skin issues. It is massively hepatotoxic. I've told you that already. Yeah. How does it come supplied? Well, there is oral. There's a liquid for kiddos, right? Okay. There's pills for us. We know that. If they cannot tolerate oral, there is a rectal suppository. We have to use it in kids a lot that can't tolerate the oral because like they're puking or whatever. We can always give a suppository. You can do it for adults too. And then yes, that is recent. I'd say within the last 10 years, acetaminophen came out IV. MD Anderson was the first to roll it out. I was on that unit when I saw it on the MAR for the first time, and I was like, he wrote this wrong. Like it said IV, and they're like, oh no, they just rolled it out. So I was like, oh cool.
So how do we get IV if this is massive liver toxic and max dose is 4 grams a day?
The dose, like the milligrams per dose, is usually 1,000 for adults. Yeah. Okay. All right. So toxic. If the patient goes toxic, which there are a lot of people that try to harm themselves with Tylenol, they will take the entire bottle. This is also a terrible, awful way to go. So if you have an aspirin overdose, remember we should aspirin, that's going to be toxic to your
aspirin is a
kidneys, though. So we're going to be worried about dialysis and alkalinizing the urine. Acetaminophen is toxic to the liver. So we need to worry about liver issues. This patient's going to turn yellow. Yes.
Bilirubin, yes.
It will cause hepatic necrosis. What's hepatic necrosis?
Your liver
Is dead. Hepatic failure, which will lead to a coma and death.
Yeah.
Now, it usually starts out with nausea, vomiting, diarrhea, abdominal pain. Okay? Then they start to sweat. If you notice that when you're overdosing on anything, you're trying to sweat it out. Because we saw sweating with aspirin as well. And then there is an antidote. Remember, there was not one for aspirin. But there is one for acetaminophen. Acetylcysteine. Acetaminophen is acetylcysteine. Don't get this messed up with aspirin. People do it all the time. You'll get on these and be like, oh, the antidote for aspirin. No, it is not. No, it is not. No, it is not. Aspirin does not have an antidote. Okay. Now, the acetylcysteine, there is a nebulized form you can give to it. It smells like absolute rotten eggs. Rotten eggs. So, and a lot of people even, obviously we wouldn't want to give it nebulized. So for the patient that was overdosing, okay, there is a PO form, but a lot of people that come in overdosing are puking. So if they're puking, there is an IV form of acetylcysteine. Okay. So I've written it about 522 times to watch those LFTs. Have I not?
Liver.
Okay. So I'm going to tell y'all, do not give lists for acetaminophen. You're going to tell me why. Do not give if the patient's an alcoholic.
Because their
liver's already shot. If they're on warfarin, careful. It is not a blood. Well, acetaminophen is not. Has nothing to do with bleeding.
Warfarin.
I did.
Warfarin is a blood thinner.
It is.
And then acetaminophen. Why you wouldn't give it? Because it's liver toxic. Oh, that.
Okay. Yeah. Okay.
Well, your liver, it does create your red blood cells.
Yeah, but warfarin doesn't have anything to do with your red blood cells. That's hypoxia, right?
Yeah.
What do y'all know about warfarin? Other than that, it's an anticoag. It's a P450. Do you want to get toxic on acetaminophen? No. I do not. If they already have liver failure, you probably ought not give them acetaminophen, okay? If they are allergic to aspirin, and I mean anaphylactic allergic to aspirin. Remember, there's a cross allergy with acetaminophen, so you wouldn't give it. So remember, anytime someone says, I'm allergic to that, what's the first question you ask?
What kind of reaction?
What kind of reaction? Because a lot of times it may not be a reaction. Okay. Why would I report a rash in patients taking acetaminophen? SJS, toxic epidermal necrolysis, all of those. Nasty skin stuff. Nasty. Monitor blood pressure in women only at high doses. Rude. Do not drink alcohol on acetaminophen. This will be on your exam in some type of way. It causes severe liver damage. So if the patient says they have more than 3 drinks a day, acetaminophen is not to be given.
It is in the review.
Yeah, it's coming for you. Now, here's fun fact. Okay, now acetaminophen does not cause bleeding, right? This is not an NSAID.
No.
And they do not know why this happens. But if you take, I have an idea, but if you take acetaminophen and warfarin for a long period of time, it increases the risk of bleeding. But I want to be clear, acetaminophen does not cause bleeding. There's an interaction in the P450. Do you understand what I'm saying?
Yeah.
All right. So NSAIDs are toxic to the
NSAIDs are toxic to the kidney.
Kidney. Acetaminophen is toxic to the liver. Very good. We got it?
Yeah.
What's your max dose of acetaminophen per day?
4 grams.
4 grams, which is 4,000 milligrams.